Hello, my name is Yula Kim with HIMS and welcome to today's webinar. Thank you for taking the time to be here today. We have an exciting program for you, but before we get started, I would like to highlight a few things so you know how to participate in today's event. At the bottom of your screen are multiple application engagement tools you can use. All the engagement tools are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you need technical support during today's event, click the question mark icon in the navigation menu at the bottom of your screen to find answers to frequently asked questions, or you can type your questions in the Q&A widget to the right of the media player. You can use the same box to submit questions to the speakers at any time. And if we don't get to all your questions today, we will follow up with you offline. Engage with today's content and let us know how you're feeling with the emoji reactions. If you miss anything, don't worry. You'll receive an email within 24 hours with a link to the on-demand recording when it becomes available. Now let's get started with today's program, Telemedicine Integration and Workflow Best Practices, sponsored by AMD Global Telemedicine. Our host for today is Carrie Souza, Vice President of Marketing at AMD Global Telemedicine. With that, I'll hand it over to you, Carrie.
Great. Thank you. And thank you to HIMS for hosting this webinar for us. Just to kind of start off the webinar, all of you probably already know this, but telehealth is growing and growing rapidly. But I think the important thing to think about here is how much, from 2019 to 2021, in a recent article actually by Healthcare IT News, it was noted that telehealth adoption has likely jumped ahead by years, 38 times more telehealth than previous. So I think we've seen more growth in the past 2 years than we have probably over 10 years or so. And AMD Global Telemedicine has been around for over 30 years. So it's a very exciting time. It's great to see all the new applications and different things coming together and different technologies. So today we're going to kind of talk about the telemedicine integration and workflow. And because of this increase in telehealth adoption, it's even more important. Users like it, clinicians like it, patients like it. And so it is more important to make sure that that workflow is nailed down and is as most efficient as possible. And mostly because of the value of time. Clinicians, healthcare providers, everybody involved in telemedicine programs appreciate something that saves them time, right? And their time. And the less time they have to worry about the technology and the workflow, the more time they can spend on patient care. As noted, the American Medical Association came out with a research study recently that talked about how 3/4 of participants agreed that telehealth fostered more quality interactions with patients because they were able to have that face-to-face with patients, even though it was virtually. They're starting to kind of do things a little bit differently and improve their workflow. And then nearly 7 to 10 want to increase the telemedicine offering. So I think this is all good signs. This is showing how telemedicine is moving forward. And so today we have 3 different presenters and panelists. We have Jim Rock from BronxCare Health Systems. He's the telemedicine program manager. Lisa Ariola, the telehealth administrator at BronxCare, as well as Amy Miller, the director of growth here at AMD Global Telemedicine. I'm going to turn it over to Jim.
Okay, thank you, Carrie. We're going to go ahead and begin by discussing the BronxCare telehealth program and how we're optimizing the experience for patients and providers. First, I'd like to just briefly describe the components of our telehealth program here at BronxCare. We have our direct-to-patient telehealth services, which is provided through a platform that we've partnered with AMD and Genie MD called Easy Connect, where we can deliver services direct to patient. We have telehealth services that we provide in the skilled nursing facility environment. This is done also through a partnership with AMD using their Agnes platform and an AMD telehealth cart located at the skilled nursing facility here that we have on premise at BronxCare, as well as at other skilled nursing facilities in the community. We have a remote patient monitoring services program that we are currently launching. We've done this in partnership with a vendor called Akipo. And through this, we are going to be monitoring the hypertension of up to 10,000 local residents in the community. We also have mobile telehealth services that we're going to be providing in the community by using basically a recreational vehicle that is currently being used as a mobile vaccination unit We're outfitting that with telehealth equipment using the AMD Agnes platform, where we're going to be able to take this unit to community centers and housing complexes located throughout the Bronx, where we will allow various individuals to get services from specialty providers from BronxCare. And those are the four main components of our current telehealth program. Now, the key aspects of the telehealth program, the first thing that we tried to do is to minimize the number of platforms. We want to use the fewest possible platforms in order to make things easier for our staff as well as for the patients. We find that by doing this, we're going to be able to increase the overall telehealth usage and the adoption of the telehealth technology. For example, we're using the same platform, the AMD Agnes platform, for our skilled nursing facility initiative, as we're also using in our mobile unit. So that's one less platform that the providers are going to need to learn how to use, or that patients are going to need to learn how to interact with. Integration with our existing systems is very important. The goal there is to integrate the telehealth technology with our EHR system in order to reduce the number of clicks involved and reduce the amount of switching between windows and the number of systems that needed to be logged into. Once again, by doing this, we find that this increases overall telehealth usage and adoption. Also, patient outreach and education are very important. We have a multifaceted program of outreach and education, including multi-language signage and patient handout material, as well as a brief patient video that lets the patients know what to expect with their direct telehealth visit with BronxCare. And finally, it's important that we're very flexible and adaptable as situations change. As we've learned, nothing is written in stone. We're constantly responding to feedback from our patients and providers to make continuous improvements to the telehealth program in order to increase its usage and its effectiveness. Now, implementation of telehealth into the workflow. There's a few things here that we needed to be well aware of as we headed into our integration and our implementation. The first thing is to understand the existing workflow. We want to have a thorough understanding of where we're starting from. This in itself can provide opportunities for telehealth to serve as a potential tool for fixing existing problems in the workflow. For example, we have over 30% no-show rate on our face-to-face appointments. Telehealth is a tool that we've been implementing in order to try to address that high no-show rate. Many clinics have implemented telehealth and implemented a policy in their workflow in order to reach out to patients who are no-shows for their face-to-face appointments by using telehealth right there on the spot. And we have found that as an effective tool for reducing those no-shows. So it's very important to have a very thorough understanding of the existing workflow as we move forward with the implementation. It's also important to remember that one size does not fit all. This flows from our philosophy about being flexible and adaptable. We tailor our telehealth services to fit into and complement the existing workflow of each clinic and each practice. We don't want to try to put a square peg in a round hole. This isn't good for anyone, as you may have learned in your own experience. This isn't good for the provider, it's not good for the staff, and it's certainly not good for the patients. So you want to make sure that once you have that thorough understanding of the workflow, you can tailor your approach and your implementation to fit telehealth into the existing workflow so that it works best for everyone, minimizes disruption, and maximizes efficiency. And finally, it's important to have buy-in from the top down. You want to work very closely with your managers and your lead providers to make sure that their voices are heard and that they are on board with what you're trying to do. Change is not easy, and few people will rush to embrace change on their own. Having the full support of leadership will help to overcome the inertia that faces any new initiative. Whenever something new is being rolled out, a lot of times the first knee-jerk reaction by a lot of folks is to feel that it's not going to be changed for the better. So it's important to kind of get that buy-in from the top down and get everybody on board to overcome that initial resistance and be able to move the initiative forward with as few obstacles as possible. And then we have aligning the vision with the reality. There's a few things you want to bear in mind when you're aligning your vision with reality. The first being to manage expectations. Change can be very difficult for individuals and organizations alike. So you certainly want to tout the benefits and the highlights of a new telehealth initiative, but you don't want to oversell it and then leave your users disappointed after rollout. It's always better to underpromise and overdeliver than the other way around. I know that when people are first rolling out a new initiative or a new technology or a new device or whatever the case may be, all anybody wants to talk about is the upside, how great it is, how wonderful it is, all the things it can do. But you want to recognize the whole thing all the way around. You want to recognize this is something new. There's two sides to every coin. There's going to be some challenges involved. There's going to be some work involved in implementing anything new. And you want to be very upfront with that when you're doing your initial rollout. You don't want to, basically honesty is your best policy when it comes down to managing expectations. Then you want to have your buy-in from the bottom up. At this point, we already talked about buy-in from the top down on implementation. So now you want to have your buy-in from the bottom up. You want to be sure to include representation from your frontline folks from the very beginning of the telehealth evaluation process, and you want to keep them informed every step of the way. You want to make sure that they know that they are an important part of the process and valuable members of the team, since they are the everyday users who will determine the initiative's ultimate success or failure. So you want to have that buy-in from the bottom up. You want to have your frontline folks on board, as well as having your leadership and your management on board as well. And then last, but certainly not least, training. That's why I have it here 3 times. Training, training, training. It is important to a successful telehealth implementation to have training of your staff, which includes medical assistants, nursing, registrars, administrators, managers, etc., training of all of your providers, and training of your patients. The more everyone understands and is comfortable with the product, the less resistant they will be to its adoption and use. So training is key, and you want training to be a continuous event. You don't want to just have a week's worth of training and then consider it done. Training is something that's ongoing. It's something that we keep touting and we keep offering to our providers, to our staff, to our patients, to make sure that everyone is comfortable with the technology and that everyone can get the most use out of it.
And something I wanted to mention, Jim, is again with the training is the adoption and the usage. You guys have done a fantastic job at BronxCare of becoming what I would call product application super users. You know the products exceptionally well, and we consider you guys experts. Understanding the application, its functionality, and the workflow is so important, and you guys have done a great job with that at BronxCare.
Thank you. We've definitely put a lot of effort into it and a lot of energy into it.
Great. Thank you, Jim. And I think Amy makes a good point. I know that it can be a long process, but the process of making sure that you train everybody along the way and retrain certainly speaks well to how you've done so well with the integration and the workflow. I'm going to turn it over to Lisa, who's going to kind of talk through a little bit more of the integration process, how that went, and her involvement.
Thank you so much. So you'll see that I'm going to talk about integration, but there's some themes from Jim's presentation that carry through. So in the beginning, we were always interested in integration. It was so great to think that information can go straight into the EMR. But what does that really mean? As we were learning and diving into the telehealth world for the first time, we had a vision of what it may look like. There is not a one-size-fits-all. Look for a platform that best fits what you need. What do you hope to accomplish? How will it help you and your end users? Integration seemed like the way to go for us, especially with the diagnostic peripherals on our cart in the nursing home. So in our skilled nursing, we have a diagnostic telehealth cart. It has a stethoscope, otoscope, a general scope, and all-in-one vitals. We can capture this information into a document and push it into the EMR. The cart does not save the data, so when you leave the session, the information goes away. So you decided you wanted to interface, but what does that really mean? Do you need it for scheduling, patient information? How will the integration help you? One of the things to think about is the right staff. Important to have the right people in the meetings from the beginning. If you are looking for EMR integration, the people who will be involved are your IT tech and your integration specialists present from the very beginning. And I mean vetting the vendor beginning, like they need to be part of those initial meetings, because they will ensure the EMR and the platform can do what everyone promises it will do and what you want it to do to benefit the practice or healthcare setting and help the end users and the patients. This brings us to ease of use. Simple sign-in. In our clinics, our providers say it's like an adrenaline rush. Our doctors and staff are so busy. The doctors are accessing many different programs on their computers that they are signing into every day. You want to make it as easy for them as possible. We kept hearing the less clicks, the better. It's all about the end user. If they don't know how to use it, or is it too difficult to navigate and log in, they won't use it. With that said, technology can be fickle. Updates happen, things change, and the end user may get frustrated. New is change, and change is hard, and everyone gets set in their ways and comfortable and don't want to change. So we always knew we wanted to make it easy for the patient. This is a cross-functional cloud-to-cloud EMR integration. So the user and the patient, we always knew we wanted them to launch it from our EMR. So either the doctor or in the nursing home, we have a telepresenter. So they both sign on into the EMR. Then you want to enter data, and either the doctor or the telepresenter can enter the data, and then you want to save it into the EMR. So that's what happens. And then Agnes Connect bundles those documents. We could take pictures, intake forms, the vitals, and they put it into a document, and then Agnes bundles it and puts it into a report. The Agnes server delivers that report to the EMR, and then the data is received, and it goes right into the EMR. So as Jim was like, wow, that's fascinating, but this doesn't just happen. Here's where the behind the scenes communication into the coding portion of the process happens. This is a back and forth process and is extremely technical. You must have your EMR IT staff and the integration group and the tech from your telehealth company all present and in constant communication with each other. Understanding this is a fluid process. You may have an ending goal, but you may go through many goal changes and modifications through this process. You'll go through numerous phases of testing, production, and then go live. Plan for the resources and time to engage in this part of the process, because it may take weeks or even months to complete. So we talked about the few clicks as much as possible. So what we did is we have an icon on the toolbar in our EMR. The doctor will click on the patient's name in the right visit, and then click the icon, and the platform opens. They will see the patient's name and the documents that the telepresenter entered, and an exam can begin. So we also made it simple for the end user, for the doctor, by having the telepresenter put in all the documents. They put in they'll take the pictures, they'll do the vitals, and they'll be the ones to push it into the AMR. And like that, an exam can begin. So that's our integration process and all the things that we had to go through make it happen.
One thing I wanted to mention, and Lisa, you touched on this, is just the time it takes to do the testing. So that's something that anyone that's interested in integration needs to take into account, is there will be significant testing in a non-production environment before this is ever rolled out in production. And you can't hurry that process. You want to find out if there are bugs or challenges or things that are not working properly before you ever roll it out in the production environment.
Exactly. We went through months, and what happens is that light bulb needs to go off with the people from BronxCare, our end of it, and with the other with AMD communications. So we were on the phone, they were talking. It was a long task, but it's really amazing when it all comes together.
Great. Jim and Lisa, you both talked a lot about, realigning your goals as you go and going in with one intention, and things change along the way and being flexible. What would you say through this process was kind of one of the biggest differences between where you thought you were going versus where you ended up?
Sure.
Well, I think we found a lot. What we've learned is that the training and the education piece of it, we needed to put a lot more into that than we had initially thought. I think that optimistically, when we started out, we thought, okay, we could run some training, get people up to speed, and then let it roll. But as I've said earlier, we found out that training and support is a continuous process that just goes on throughout the whole life cycle. And I think that was probably one of the biggest differences that we saw. Especially on the patient side, we're constantly looking at new ways to reach out to our patients, to train our patients, to educate our patients on telehealth, on how it works, on what they need to do. And we've also learned that, there are patients that telehealth is just not a good fit for. They either do not have the device that is capable of engaging in a successful telehealth visit, or they're just not technically savvy enough, no matter how much education we provide, to engage in a successful telehealth visit. And we just need to recognize that there is going to be a percentage of patients that are not a good fit. Sometimes I'll use my own mother as an example. My mother is 87 years old, and she is basically a technophobe. So that's something, she's the kind of person that would not engage and could not engage in a telehealth visit, no matter how much, we sit there and try to help her with it. So there's folks out there that fall into that category, and you just need to recognize that as you go forward, and maximize those that you can work with, and also recognize that there's ones that are not going to be a fit.
Great. Okay, now we're going to turn it over to Amy, who's going to talk a little bit more about the technology and how it can integrate with your existing infrastructure, and kind of going through the process of what that looks like.
Yeah, and there's a few things that we want to do here. One is we want to show you a video of Agnes Connect. So you've heard that mentioned multiple times in the conversation. So we're going to show you exactly what the platform looks like. And then we'll talk about telemedicine integrated with your EMR system versus telemedicine not integrated with your EMR. So this is a video of the Agnes Connect telemedicine platform.
AMD's Agnes Connect makes it seamless for you to scale your virtual care programs to the next level. If your healthcare organization is looking to extend your services past the traditional brick-and-mortar environment and transition beyond the limitations of video-only visits, then Agnes Connect is the telehealth solution for you. Agnes Connect is designed to complement, not replace, your existing infrastructure and virtual care tools. Healthcare organizations around the world are choosing Agnes Connect over other telehealth platforms because it supports the clinical needs of multiple applications across a wide range of specialties, and all within a single platform. To optimize the user experience, Agnes Connect matches the workflow of an in-person visit. Let's walk through the experience so you can see for yourself how it works. An on-site clinician works up a patient by capturing their vitals and preparing intake materials for the remote provider to review before the consult. This information is shared through Agnes Connect, so the remote provider has full visibility into the patient. Once the provider is ready to see the patient, they log into the secure HIPAA-compliant platform through a browser, and then select the site or location they wish to connect to for the virtual visit. As you can see, Agnes Connect is designed with multiple modules shown on the left-hand side. Each of these represent various steps in a clinical patient encounter. This allows our customers to purchase only the modules they need initially, but then easily add on as their program grows and their clinical needs expand. One of the biggest differentiators of Agnes Connect is that you can capture and stream medical images from the integrated devices simultaneous to your video session. With the option to connect over 40 medical devices, you can accommodate a wide range of clinical demands from low acuity to high acuity care applications. At the end of the consult, all the information collected during the session can be easily sent to your EMR to update the patient's record. Agnes Connect is backed by AMD's proven experience with telemedicine and telehealth for over 30 years. The solution is trusted and used by leading healthcare organizations around the world to support the continuum of care.
So I wanted to spend some time talking about the different types of integration. Obviously, this is not something that your frontline people would be concerned with, but definitely the folks that are in your IT department. And even though you may not recognize what all this means, I'm sure that they will. So there's essentially 3 different types of integration that AMD would provide with the EMR system if integration were required. So there is HL7, so that stands for Health Level 7 International, and it's a set of standards and formats and definitions for exchanging and developing health record information. There's also API, so that's Application Programming Interface. So it's a software intermediary that allows 2 applications to talk to each other. And then the third option, which is the option that BronxCare chose when working with AMD for the integration, it's Redox Integration Engine. So Redox is an integration leader. So they have integration with over 85 different EHRs and health information exchanges. So let's talk about integrating Agnes Connect telemedicine platform with the EMR versus without an EMR. So with an EMR integration, there's definitely some things you need to consider. One is time. So we can provide single sign-on with Agnes Connect EMR integration. So that allows the user to sign into the EMR and then also connect to Agnes Connect through that EMR system. And that's what Lisa talked about earlier, is having that button inside of the platform, being able to hit that and launch the telemedicine session. The other important point is if you're wanting to collect discrete data, so for instance, vitals information, blood pressure, SpO2, things of that nature that would be numbers, that discrete data can be transferred from Agnes Connect into the EMR system. Also, we're able to pull information out of the EMR system, such as the patient name and demographics information, instead of having to type all of that in manually. Something else you want to consider is there's typically a cost for integration. So there would be a cost upfront for the development work, but also there's oftentimes an annual cost for the integration as well. And deployment timeline. So it could take anywhere from 30 days to 6 months, depending on the level of integration and the complexity of the integration. So if you feel like that the integration is maybe not a requirement or not something that you're able to do due to finance or time, you can obviously use Agnes Connect without an EMR integration. So you still have the ability to type in notes, save medical images, do a sessions document, and you can save that as a PDF, and you can actually upload that into your EMR system. Again, it's not discrete data, but that data can be added as a PDF file. There's no integration cost, so if you have a limited budget, you're not having to look at that upfront cost as well as an annual cost. And then if you need to get the telemedicine platform up and going pretty quickly, then you're not going to have that delayed deployment due to the development work that may come along with an EMR integration. So essentially, there's 4 things to consider with an integration, and I think Lisa and Jim have both done a great job talking about these things. But if you're considering the integration, you need to think about what is your launch timeline. Are you trying to get your telemedicine platform off the ground quickly? If the answer is yes, then you may not need to do an integration possibly from the get-go. That's something you could even do later in time. Also, budget. If you're considering the integration, you need to have a conversation about what would it cost for the integration? What's the upfront cost? What is the cost annually? What does the statement of work look like? What type of workflow is needed? So is an integration actually required for what you're trying to accomplish? Would it significantly decrease time? Would it decrease efforts in signing into the application? And then what type of resources that you have in-house. So having that technical team buy in, having them available at all the meetings, having someone to manage and coordinate the project and keep things moving along if you decide to do an integration.
Great. Thank you, Amy and Jim and Lisa. Just based on your experiences, Lisa and Jim, obviously at BronxCare, and Amy, yours with other customers as well, what are some of the tips that you can give them for making it like not causing too many steps, not making it too difficult for the clinicians or the healthcare providers to do the telemedicine consults?
Well, I think that the thing that you want to do, as I mentioned earlier, is you want to keep things as simple as possible from every angle of it. Both on the provider side with the integration, you want to minimize the number of clicks that they have to go through in order to get their job done. You don't want to add much to their workflow. You want to try to fit the technology into the workflow rather than try to make the workflow fit with the technology. And then on the patient side, as I said, what you want to do is you want to keep things as simple as possible, minimize your clicks as well, and provide them with as much training as possible. And the training needs to be very simple, bare bones, right to the point type training. You don't want too many bells and whistles. You don't want to stretch anybody's attention span too much. You want to make sure that you just give them the basics. Here's what you need to do, and keep it as streamlined as possible.
In sync with what Jim was saying, the workflow is really important. One of the things that I keep on asking them is, how do you do it when you do it face to face? It really shouldn't be that much difference, but we tend to think that there is a huge difference just because we're not seeing them face to face. But for some reason, technology does bring a little bit of a change, and there's a little bit of a change in workflow. But for the most part, if you keep on thinking, how do we do it face to face, they will come up with the answer.
It's a good point. I think matching it as closely as possible to that in-person experience is what makes the programs so successful. What would you say when there's a consult between the clinician and the provider? I know, Lisa, you mentioned that the information can be documented into the EMR from either person or either side. How did you decide who would be the one to do that documentation? Is it the same every time? Does it change?
It is the same every time, and it is basically to give the provider the least amount of work as possible. So we said, well, the telepresenter is going to have to learn how to do this and be the one to make, to set up the vitals and to learn how to put it, do the next steps to push it into the EMR. So it's the same every time. And it's just because we wanted to make the provider have the least amount to do as possible, because at that point, they just, that's how it worked.
Okay, great. Somebody asked if you could go back through, I know you mentioned having all the key people in the decision-making process, also involved in the vendor vetting. Which roles would you say, can you define those again as far as who needs to be involved in that vendor vetting process?
So to go for strictly integration, you need your integration person for your IT from the very beginning. You know, when we have these meetings, when we start to vet these people, you always have your presidents, your directors, and those aren't the people who are going to be doing the work. They're going to make the final decisions, obviously, but it's from the information that they get from their staff. So integration needs to be part of it. You should always have somebody, a clinical person involved in the vetting, who's doing the work, who understands the scheduling, who understands your patients. So those are the main, your integration, definitely a clinical person at all times, and some of your people who are going to be using it. We have these registrars and MAs. Those are really important people to know also. They don't need to be at all the meetings, but they should be brought in for certain information.
Okay, great. And then just to close it out, maybe talk a little bit more about, I know you started off using it for certain types of consults. Jim, you mentioned using it for no-show rates to help improve that. Kind of from start to finish, did you start with one specialty area and then expand from there? How were you able to scale the program into other areas?
So with Agnes, our nursing home, with our skilled nursing facilities, we really we were thinking of who do they see the most? Who did the patients go out of the facility, and how can we, minimize that as much as possible? So we picked, so the director of the administrator of the nursing home said, these are our 3 clinics that we would like, so we did those first. Those clinics first were targeted. Yep. Didn't always work out like that, but you do want to start slow. I know it seems tedious, but you do want to start slow with one clinic or one specialty at a time.
Very good point. And I think that's a good lesson. And we've seen that for, as long as we've been doing telemedicine and helping customers, that usually starting slow and focusing on one thing at a time definitely pays off in the end. I mean, obviously there wasn't much choice in the last few years. I think people had to move fast, but I think that's a very good point and a good lesson learned. Great.
Absolutely.
I guess if you guys have anything else to add, otherwise we are at the end of the session. Thank you everybody for joining us. And thank you, Jim and Lisa and BronxCare Health for sharing your story. Amy, thank you for sharing your perspectives as well on the technology. And thank you very much. Have a good day.
Thank you so much for such a wonderful presentation. At this time, we have to wrap up. We would like to thank our sponsor, AMD Global Telemedicine, once again for their support of this webinar. Don't forget to take our brief evaluation at the conclusion of today's event and share your thoughts with us. As a reminder, you'll receive an email within 24 hours to rewatch the on-demand recording of today's session, and it will be available in the HIMSS Resource Hub for a limited time, so feel free to come back and watch at any time. Thanks everyone. Have a great day.